Hi everyone, my name is Destiny Blade and today I am going to be talking about Oppositional Defiant Disorder, also known as ODD. So what are the defining characteristics of ODD? I'm going to be covering the signs and symptoms, statistics, comorbidity rates, and risks. So what is oppositional defiant disorder? ODD is a behavior disorder, and these children are often defiant, hostile, and uncooperative towards peers, parents, and authority figures. Ages 5 to 10 are thought to be relatively stable in terms of symptoms for children with ODD. And after ages 5 to 10, these symptoms are thought to decrease with age. If these symptoms do not decrease with age or they continue to increase, the child will likely be diagnosed with conduct disorder. Here I have a video of Ethan, who is diagnosed with ODD. So, what is the diagnostic criteria for ODD, or how can someone be diagnosed with ODD? According to the DSM-5, an individual needs at least 4 out of the following symptoms on this list for most days over a 6-month period. And these symptoms should have distress on the individual, family, and or peers and cause significant impact on daily function in social, educational, occupational, or other important areas of life. And so some of these symptoms are, they often lose their temper, they are touchy and easily annoyed, they're often angry and resentful, they'll argue with authority figures, adults, adolescents. They refuse to comply with requests and rules made for them or by them. They often intentionally annoy other individuals, and they often blame other people for their own mistakes and misbehavior. We move on to statistics and comorbidity. So the lifetime prevalence for ODD is 10.2%. The prevalence at any given time is between 2 and 11%. And the gap in this range is simply due to the new development of this diagnosis, and criteria is being changed and developed on how to diagnose and classify this disorder. So there is quite a gap in the statistics right now. The rough ratio for male to female, remember this is a childhood disorder, so this is pre-adolescent male to female. Males are almost 2 times as likely to be diagnosed with ODD than females are, with a ratio of 1.4 male to 1 female. As previously mentioned, ODD often precedes conduct disorder. Over 90% of individuals meet criteria for comorbidity with other diagnoses. So 45% meet it for mood disorders, 62% comorbidity for anxiety disorders, 68% impulse control disorders, and 47.2% for substance use disorders. And so these can also serve as risk factors that are important to look out for. Moving on to theories and influences of origin. So first we are going to be talking about learning theory. And so the learning theory serves as negative reinforcement. And you might think, why would anyone want to reinforce behavior like this? And it's not intentional. This child is seeking a specific reaction or just attention from someone, and by acting out they get that, and so it reinforces their behavior and they're more likely to act out again in order to receive the reaction or attention that they want. The other theory I would like to address is developmental theory. This theory goes along with my picture over here as the inner child, and so it suggests that it begins as toddlers when we are learning to be independent from our parents, our guardians, our caregivers, and there is this sense of separation anxiety. However, these children, for some reason, have a hard time getting out of this phase and moving on, and it eventually becomes not developmentally appropriate anymore, not only because they're past the age where it's developmentally appropriate, but their behaviors are no longer within reasonable actions. They are much more severe. Moving on to contributing factors. So some environmental factors that may affect ODD are obviously if the child has a history of abuse, maltreatment, or neglect. As we stated, if this child is being neglected by their parents and all they crave is for their parents to pay attention to them, they will act out in order to get any attention, positive or negative, from their parents. Another contributing factor is inconsistent parenting, and this goes along the lines of making false threats and not following through, setting up rules and boundaries but not enforcing them, and things of that nature. Other considerations that could indicate, exacerbate, or initiate ODD are peer groups, socioeconomic status, the neighborhood crime rate. These individuals particularly take rejection hard, as well as other significant life stressors are harder for them to cope with. We move on to biological factors. It's estimated that 50% is heritability, and it is also closely associated with many other disorders, as we have discussed in our comorbidity previously. It's also thought to affect the prefrontal cortex, the amygdala, and the insula. We also believe that there are changes in cortisol levels and MAOA levels in the blood. Last but not least is treatment. So what are these interventions? It is important that we get to these children early in order to combat these behaviors so that they will not receive a conduct disorder diagnosis. And it is very important that the family is involved in the treatment of this disorder. So a huge thing is parent management training, and this gives parents the ability to learn, one, how to cope with these behaviors, but how to deal with them, how to redirect them, how to avoid these behaviors and instill behaviors that you want. School-based interventions could be as simple as providing education for the parents and the child, or tools and resources are provided by schools that may not be as easily accessible at home or by legal guardians. Family therapy can be very useful in this situation, as it usually causes a great divide in the family. Group therapy for the child with other children is beneficial, as well as parents receiving group therapy from other parents is beneficial. Cognitive behavioral therapy for the child is probably the #1 suggested treatment currently. Some medications that may be given on occasion are antipsychotics, mood stabilizers, and specifically in individuals that have comorbidity with ADHD, stimulant and non-stimulant drugs are given, and I have provided a few examples of the types of drugs. Thank you for joining along with me today, and I hope you learned something.